And the chat will be a part of a public record, so just want to be sure that you're aware of that. All right. Also, please note that for today's training, you will be able to submit anonymous questions to myself and Rachel, the host for the call, and you can do that at any point during the conversation. All right. So we really want to thank you for joining today's crisis response training related to elevating the voices of peers in crisis response. My name again is Heidi Arthur. I'm with Health Management Associates. HMA is a leading independent national research firm and consulting firm that focuses on improving the administration and the delivery of public health, healthcare, and social service programs. HMA is supporting the Mississippi Department of Mental Health in its efforts to enhance the state's crisis response system by providing these monthly online crisis response trainings. Joining me today is Sataniel Wembley, Director of the Division of Peer Recovery and Support at the Mississippi Department of Mental Health, and her role includes coordinating peer support services at DMH, certified providers and DMH operated programs. And so Sataniel will join me in the Q&A to help field questions. Next slide. So our objectives for this training include really a description of the peer workforce and the different types of peer support available in Mississippi, the role of peers and the relationship that they have to preventing and de-escalating crises and promoting recovery, as well as some strategies for effectively collaborating with peers within the crisis response system. Next slide. So who are peers? Generally speaking, across the country, peers are in a variety of different places. Next slide. And they're often called by a variety of different names. Peers are folks who have been there. They're able to share power with those that they serve because they have actually experienced some of those same things, and that lived experience allows them to build connections, offer empathy, and really validate the experiences of those they're supporting. They serve as advocates and they build hope as a living example of recovery, and they're able to really help foster connections to resources in the community and really respond to cultural and linguistic needs, often because they look and speak like those they are serving. The same languages from the same communities, they are literally side by side partners in recovery support. Next slide. I mentioned that they're called by many names, and here you can see just a variety of the ways that peers are often titled or labeled within community settings. You have peer advocates, promotoras, peer health navigators, health advocates, community health representatives, just a whole variety of different names. Next slide. And they're not new. Peers and community support facilitators have been around since the beginning of time, if you think about midwifery and how community health has grown up. But in mental health, beginning in the mid-1800s in France, peers were recruited as hospital staff as well. AA is an early peer support initiative that most people are familiar with. The peer self-help recovery movement started in the 1930s. And then in the 1960s and 70s in the United States and abroad, the mental health consumer movement really began. And in Indian health services, outreach health workers began being hired in many communities across the country. Lay counselors were introduced to support folks in mental hospitals. And then in the 80s and the 90s, migrant farm workers had health promoter projects that were funded through the US government, and multiple states began to integrate consumer liaison roles. Next slide. Things really got momentum in the 90s, in the late 90s. Georgia was the first state to gain Medicaid approval for the certified peer specialist role in Medicaid to actually finance that specific certification and that specific workforce role. And SAMHSA began to publish guidance beginning in the early 2000s, and the Affordable Care Act really accelerated the integration of peer support, and community health supporters really beginning to integrate those vital roles throughout the healthcare delivery system. And then obviously in the COVID-19 pandemic response, peers and community health workforce was extraordinarily important in promoting access to services and addressing gaps in the health response. So where do peers work? In the behavioral health continuum of care, they work all of the places. They operate out of freestanding community-based organizations and recovery community organizations, or RCOs. They are peer-run organizations, drop-in centers and clubhouses, community mental health centers, all across the outpatient, inpatient program continuum, as well as in community health centers, emergency rooms, inpatient units, residential treatment settings. They're in all of the places, and increasingly, they're in more of the places than they were before. Next slide. Often they might serve special populations and specific targeted programs. And here you can see a variety of the kinds of programs that might integrate peer support in order to really best engage folks with lived experience in particular areas, particularly around veteran programs and in reentry from the carceral settings. Youth mentoring programs often leverage youth peer supporters, and obviously home visitors are frequently staffed by people who have lived experience of the very systems in which they're helping people connect. So peers in all places is not uncommon, and it's increasingly becoming the norm. Next slide. The roles that peers play really are across the continuum of interventions, from outreach, engagement, providing screening support, really facilitating that individualized approach to an individual person's needs and their priorities for goal setting, providing mentoring, and really helping to facilitate their connections to those local resources, and helping to be that kind of voice for outreach, follow-up, and continued emotional support and empathy. They can facilitate harm reduction and really help people think beyond what is traditional, like sort of treatment or formal care and intervention, to recovery supports that relate to helping people feel better and more connected to things that help them really advance in their recovery. They share resources and help support skill building and foster connections throughout the community so that people are reintegrated and reconnected to not only their family support, but also to community resources and networks. And they also do a lot of education around social health, psychosocial health, and they also can be integral in delivering and being part of evidence-based interventions and supporting access to social health services and just navigating the whole system across crisis response, as well as in providing kind of a voice for continued improvement of the care that people receive and being that advocacy momentum for an individual, as well as for those being served by a program or agency. In Mississippi, peers within the substance use recovery community are the certified peer support specialist role. They're a family member or an individual who has self-identified as having received or receiving behavioral health services, and they've also completed the formal CPSSP training that is provided through the Mississippi Department of Mental Health and has been employed by a Department of Mental Health certified provider. So very specifically in Mississippi, there might be peers in all of the places, but within the mental health and substance use recovery community, very specifically, there is also a certified peer support specialist role, and this is what we're talking about. Many other peer support specialists are working out of the state behavioral health system, and they're not classified as certified. So this distinction is important to understand. They're peers, but they're not certified peer support specialists within the Mississippi continuum of care. According to SAMHSA, the Substance Abuse Mental Health Services Administration, peer support workers are those people who have successfully navigated the recovery process and are now able to help other people face similar issues. And they've had some sort of special training that enables them to effectively use that lived experience to help other people access recovery and foster mutual understanding through fostering mutual understanding, respect, and empowerment. So here you have three different levels of definition. The sort of formal definition of the peer support specialist within Mississippi's system, a broader understanding of peers as they might be in a variety of different spaces serving targeted populations, and then federally, what does SAMHSA consider to be a peer? Next slide. So when we go back to that Mississippi definition of the CPSS, we're going to talk about what that role does and what it does not do. So a CPSS in Mississippi is a person in recovery with that lived experience that they're trained to share and talk about, to be a role model. And they see individuals in the context of their roles, their family, their community, and they really motivate through hope and inspiration and support a whole variety of different pathways to recovery, not necessarily limited to that person's engagement in formal treatment, but really looking more broadly. And they're an advocate for that person who's in recovery, both in and out of whatever program that person might be engaged in for the purpose of their recovery support. They foster independence and teach people how to access needed resources across behavioral health, social health, medical, and other types of services for their recovery. And they share knowledge about local resources and really encourage, support, praise, and they help to set some individual personal goals with people. What they are not is a clinician. They're not a professional clinician. They don't give clinical advice. They're not an expert or an authority figure. So again, that they're sharing power. There's an equitable role, and they do not see the individual as a case or by diagnosis. They don't motivate through fear or any kind of negative consequences, and they don't recommend one specific pathway to recovery. So they're not sort of directive in how they engage with people about what they need to do or should do. They are really listening and advocating for what a person's own priorities might be. They do not represent perspectives of any particular program or agency, and they don't foster dependence, or they don't provide basic necessities such as a place to live or money, and they don't provide case management services. They don't diagnose, assess, or treat, and they don't mandate any particular tasks or behaviors. So this chart is really important in sort of breaking down the role of a peer support specialist, what that role entails, and what it does not entail. Next slide. The scope of practice in Mississippi for the Certified Peer Support Specialist Professional, that CPSSP that we're talking about, there are specific training designations. There's adult and recovery training designation, and that's for individuals who have a personal lived experience with a behavioral health diagnosis, a mental illness, or a substance use disorder, who can demonstrate their efforts in self-directed recovery. There's a parent caregiver CPSSP role, and that's a person who trains biological and adoptive parents or relative caregivers who have permanent legal custody, or who are raising or have raised a child with an emotional, social, behavioral, or substance use disability. So that's a person who has that lived experience and brings that expertise to those folks who are raising or have raised a child with an emotional, social, behavioral, or substance use disability. And then there's a young adult designation, that scope of practice for an individual between the ages of 18 and 26 who have their own lived experience with a behavioral health diagnosis, mental illness, or substance use disorder, and/or mental health and substance use disorder, a person who can demonstrate their efforts in self-directed recovery, who in turn are able to bring that lived experience to young adults and to families. Next slide. There are also designations for forensic peer recovery. These individuals have personal lived experience with a behavioral health diagnosis and with a history in the criminal justice system, who again can demonstrate their efforts in self-directed recovery. Peer bridger support specialists are trained to improve transition from inpatient care to community-based settings and are able to improve quality of life and reduce the need for readmission while increasing the number of individuals who attend their follow-up appointments. So that's a very specific role, the peer bridger support specialists. And then there's peer supervisor training. And this is peers who have been trained to equip DMH certified providers, administration, management, and supervisors in the state mental health system, providing the effective tools needed to oversee those DMH certified peer support programs and support staff. So another peer role is for supervisors of peers. So in terms of the scope of activities, so utilizing their unique recovery experiences in Mississippi, the CPSSP teaches and models the value of every individual's recovery experience, models effective coping techniques and self-help strategies, and really encourages peers to develop independent behaviors based on their choice rather than on compliance, again, with any particular program mandates or policies. So really that intrinsic motivation, they're meant to really help partner with people and promote their own person-centered plan and goals. Their role is to establish and maintain a peer relationship rather than a hierarchical relationship. And by that, we mean that power sharing dynamic. They're not in an authoritative role over or a directive role with a person who's in recovery. Very important distinction. So the scope of activities, they're meant to utilize direct peer-to-peer interaction and a goal-setting process to understand and utilize specific interventions to assist peers in meeting their individualized wellness goals, leading as well as teaching about wellness and through focused in conversations and other evidence-based or best practice methods. And they teach the skills that are necessary for the self-management of symptoms. They teach other people how to overcome personal fears and anxieties, and they assist peers in talking through and articulating their personal goals and objectives, identifying what they want to achieve, and then helping them think through strategies to do that. They assist peers in creating their wellness plans, for instance, through Wellness Recovery Action Plans, the WRAP, or Declaration for Mental Health Treatment or crisis plans, and they assist peers in setting up and sustaining self-help groups. They appropriately document activities provided to peers in either individual or program records. Next slide. So they also maintain a working knowledge of current trends. They read journals and other books and material. They develop recovery-oriented material and share it amongst their network of other certified peer support specialist professionals. And they attend seminars, workshops, and educational trainings that are available. And they serve as a wellness agent. They provide and promote wellness-based services, assist peers in obtaining services that are based on the peers' wellness needs, again, and they assist peers in developing empowerment skills and becoming self-advocates. And they also help people problem solve so that they can respond to any of those challenges or barriers to achieving their wellness goals. And the peers share their own unique perspective on recovery from mental illness and substance use disorder with non-peer staff, really helping to facilitate an understanding of the peer role. And they assist those non-peer staff in identifying programs and environments that are conducive to recovery. So really kind of bringing recovery wherever they go, if you will. Next slide. Peers in Mississippi follow a peer code of ethics, and here you can see they're enumerated. They're guided by the principle of self-determination for all, with a primary responsibility to support peers in achieving their own needs, wants, and goals. They advocate for the full integration of individuals into the communities of their choice, and they really promote the inherent value of each individual within those communities. They're directed by the knowledge that all individuals have the right to live in the least restrictive and least intrusive environment, and they advocate for those they serve so that individuals can make their own decisions in all matters when dealing with other professionals. Peers openly share their stories about hope and about recovery, and they identify and describe the supports that really promote recovery and resilience and they always conduct themselves in a manner that fosters their own wellness, and they stay current. They read and they really stay on top of emerging knowledge related to recovery, and they openly share that knowledge with other peer support professionals. They also refrain from sharing advice or opinions outside of their scope of practice with the individuals receiving services. And they maintain high standards of personal and professional conduct and never intimidate, threaten, harass, or use any undue influence, physical force, verbal abuse, or make any unwanted promises of benefits to the individuals they support. These peer support specialists will not engage in any psychological abuse, neglect, or exploitation. Next slide. They never engage in exploitative or sexual or intimate activities with the individuals they serve, and peer support specialist professionals never enter into relationships or commitments that conflict with the support needs of the individuals they serve. They don't practice, condone, facilitate, or collaborate in any kinds of discrimination based on ethnicity, race, sexual orientation, age, religion, national orientation, national origin, marital status, political belief, disability, or any other preference or personal characteristic, condition, or state. They respect privacy and confidentiality for those they serve and really have a duty to inform service recipients when they first begin serving them about confidentiality, and that contemplated or actual harm to self or others will not be kept confidential. They have a duty to accurately inform service recipients about the degree to which information will be shared with other team members that the peer might be working with based on agency policies, their job description, and peer support specialist professionals have a duty to inform appropriate staff members immediately about any person they're working with and the possible harm to themselves or others that or abuse from caregivers that might be happening. They provide services and support within the hours, days, and locations that are authorized by the agency in which they work, and they don't loan money, receive payment for services to or from individuals receiving their services, and they don't exchange gifts of significant value with those they're supporting. They don't abuse substances under any circumstances, and they strive to create a professional, safe, and healthy work environment through their words and their actions, and they utilize supervision and abide by the standards of supervision that are established by their employer. Overarching peer support, we know across the board improves outcomes. Research has demonstrated that people who receive peer support services experience an increased sense of self-efficacy, increased social support, broader networks, improved functioning. They're able to cope with stress and improve their quality of life. And they have demonstrated increased ability to communicate with their providers in the traditional healthcare and behavioral healthcare system and reduce symptoms of substance use and reduce need for physical health services, including hospitalization. They have improved outcomes related to employment, housing, economics, their finances improve, and they have reduced mortality rates, particularly for suicide for people who have addiction. Next slide. So let's talk through just a couple of case examples so you can start to imagine what a peer support specialist looks like. Adam is a CPSSP who helps adults who have needs related to substance use. He provides community outreach and engages people in an emergency room. Kiara is a CPSSP parent caregiver. She supports people whose loved ones have a mental health or substance use condition, and she's part of a home-based intervention team. Letitia is a CPSSP who helps people experiencing behavioral health crises, part of a mobile crisis response team. Jack is a CPSSP youth specialist who helps young people experiencing a first episode of psychosis. And Naomi is a CPSSP who helps people who are unhoused connect to needed housing and other supports. So you can imagine each of these roles in different settings within the community, doing different work with different types of populations. They'll have different networks of organizations that they collaborate with and liaise with on a regular basis, and they're part of a different array of other organizations and systems supporting the same populations that they're serving. Next slide. So take a moment. Who do you know who would be a good CPSSP? Based on what we've talked about, consider who you know who is, would be, or has been an ideal peer support for you or a loved one during a crisis or a difficult time? So take a minute, use this poll, reflect on how they shared their lived experience and your response to their support. So this is a person who may not already be a peer, but you know them, they kind of fit the bill, or you know that they've been helpful. Peers, again, they embody recovery. They're a living example of recovery and they promote hope. So crisis care provides services to anyone, anywhere, at any time, and peers are vital to crisis response. They offer opportunities for individuals in crisis to talk to someone who has had similar experiences, and they can help strengthen that person's engagement in treatment and facilitate trauma-informed responses and strength-based approaches that are recovery-oriented. So they bring that lens to act as an advocate for individuals who are experiencing crisis, increasing their trust, reducing their agitation, and decreasing the use of the emergency room for mental health and/or substance use disorders. And they reduce the recurrence of symptoms and recidivism in that cycle that people can so often fall into. Next slide. So they're included across the crisis response continuum. Peers provide crisis services at every level of crisis care. In prevention, they're doing that outreach, they're responding to warm lines, they're part of crisis planning, they promote that harm reduction, and they facilitate engagement with community supports to avert crisis and reduce the need for more acute supports. We talked about that RAP planning, supporting the goal setting, really doing those things that would prevent a crisis from happening. As well, during crisis management, de-escalation and stabilization, peers de-escalate the crisis. They can conduct that non-clinical assessment, provide advocacy, and support transitions as needed through levels of care. In crisis resolution and post-crisis care, peers provide follow-up support to engage people in care, facilitate safety planning, and help people address the factors that contributed to the crisis in the first place, implementing strategies to prevent crisis from reoccurring. And this could include helping individuals manage their symptoms, navigate ongoing treatment and care, and transition to ongoing services within the community. They can also support families and help make connections to resources. Especially critical for children and youth, that family support role is really vital in understanding the resources that are available. Next slide. So peer inclusion in Mississippi, it's someone to contact. That 988 crisis response is ideally peer operated and clinician supervised, someone to respond. Mobile crisis and outreach services, they're team-based. They're inclusive of certified peer support specialist professionals with specific roles and responsibilities as a member of those teams. A safe place for help. Emergency and crisis stabilization services have a multidisciplinary team model as well, and peers are included as support staff in those places. So let's look at a scenario. Peer response in crisis care. Adam's 22 years old. He's a recent college graduate who has just returned to his hometown and started a new job. His supervisor contacted the local community mental health center because Adam reported to work in a state of agitation, saying things that just don't make any sense. Adam told his new coworkers that he's feeling out of control. Anything could happen. He's alternately crying and saying he's a failure, and then shouting that he's capable of anything. The mobile crisis team responded. Adam was unwilling to talk with the clinician, but agreed to peer support from Monica, a peer support specialist, after learning that she had previously been helped by the community mental health center. Monica shared with Adam that she has a history of people being concerned about her behavior because she experiences episodes during which she hears voices that no one else hears, and also because she has used opioids. Adam shared that he also has a history of drug use and has relapsed several weeks prior. He shared that he's not slept in several days because of his heavy use of methamphetamines and cocaine. And based on Monica's description of the program that helped her, Adam agreed to be escorted to detox. So let's take a minute to reflect. What was unique about Adam's experience because he was provided with support from a peer? What might his outcome have looked like without peer support? Right. We'll leave that poll's probably closed by now. We're able to share out anything now or later, we will. I'm going to move to the next slide. So how do we promote peer support in crisis response? Some important consideration for peers in the crisis continuum really relate to protecting the peer role. Peer drift is a phenomenon that occurs when non-peer colleagues either marginalize peer support workers and assign them tasks that are not in alignment with their dedicated duties and responsibilities, their scope of practice as peers, or when peers themselves act or behave in a role that is different from that of a peer. Peers might, on one side, begin to act more like a friend, a sponsor, or an informal therapist as a consequence of drift, or peers might start to work more like part of the clinical team and begin to sort of take on a role that would be more like a program sort of staff specialist or expert. Peers working within the crisis continuum are especially vulnerable to peer drift as they work with clinicians and other non-peers. And those responding to a crisis, including non-peer staff and peer support workers themselves, should not coerce individuals to participate in services. Non-peers should not request peer support workers to use their relationship to influence an individual's decisions. Peer drift, this sort of confusion around roles, this sort of slide in these directions around either becoming more like a friend or more like a clinician, that contributes to burnout. Avoiding peer drift supports the retention of the peer support workforce. Next slide. So clear roles, training, and supervision for all members of the team are really important to sustain peer services. So this includes establishing, promoting, and maintaining respectful, person-centered, trauma-informed, and culturally competent behavior and language throughout an entire organization. So creating a culture that is respectful and trauma-informed and person-centered will help to preserve peers. And developing clear job descriptions and training all of the team members to respect and protect that peer role is really important. Training and then supervising non-peer staff on how to work with, how to supervise and support their peer colleagues is important, and ensuring that supervisors monitor peer support roles to identify drift and address it before it gets kind of locked in and becomes institutionalized practice. That's just the way we do things, right? Identifying it early so there can be intervention to pull the role definitions back into place. Involving peer support workers in program planning, program training, and quality improvement activities can really help to engage their input throughout the service delivery continuum and ensure team-wide awareness of their value. Supporting and modeling self-care is important not just for peers, but for the entire team. And crisis situations can be tense and they can be complicated. Peer support workers and other responders whose own previous experience of crisis or trauma may trigger distress will require support from someone who's trained to understand the peer role and provide prompt support in post-crisis briefing and post-crisis support. So anyone on a crisis team needs debriefing and assistance, and peers may need specific, specially trained support and post-crisis debriefing in order to be sure that they're okay and can be okay to support those they're helping to be okay. There are a number of resources in Mississippi for peer support. NAMI Mississippi provides educational resources and free peer-led support groups for adults who are living with mental illness, adult family members, and caregivers. The Mental Health Association of South Mississippi provides resources and support services for those who are seeking mental wellness and recovery within any community. And that includes mental health, intellectual disability disorder, substance abuse, and homeless issues in South Mississippi. Families as Allies is a statewide family-run organization for families of children with behavioral health challenges, and the mission of Families as Allies is to make sure that families are partners in their children's care. to protect that family support role and provide that to families who have children with behavioral health challenges. The Association of Mississippi Peer Support Specialists is an organization that provides support, advocacy, and resources for peer supporters in Mississippi, and they offer continuing education, self-help resources, and more. Next slide. These are a number of references that'll be available to you when you get the PowerPoint deck, including resources from the Department of Mental Health Peer Support Service site. A lot of the resources that we described today would be available there. The DMH Peer Support Specialist Professional Principles and Ethical Conduct Guide is available, as well as the SAMHSA advisories that were mentioned in the early part of this training, and then information about each of the peer support resources that we described. Links to their pages are available. So in closing, just want to say thank you for completing this training. The training library contents will be developed between May of 2025 through June of 2026, and you can check the DMH website frequently for updates and new training uploads. So before we move to the very last slide and the upcoming list of trainings, we just want to open it to any questions that people might have from this training. So Taniel, I see that you're on the training, and Rachel, if you want to unmute folks so that they can ask questions. So Taniel's here, and she and I are both available to respond to people's questions. And so Taniel, if there's anything that you'd like to add to this training, your expertise is so valuable. We'd love to hear from you.
Good morning, everyone. I think you all covered everything perfectly. If there are any additional questions, I would suggest that anyone check the DMH website in reference to peer support. We can put that link in the chat if necessary and share that information when the actual information is shared in the future. But if there are any questions, anyone can feel free to call me or email me at any time, and I'll put my information in the chat as well.
Beautiful. Thank you, Satania. Nice to see you. Satania and I collaborated in developing these slides, so really nice to see you.
You as well.
Okay. Feel free to come off mute. I think everybody's unmuted now if you have any questions, or you can put them in the chat. Rachel, can they put them in the chat? Do we? Okay.
The chat is now open for questions if anyone has anything they would like to put in there.
Thank you. And Rachel, is there anything from the poll that we could share back with people? Did that work?
I can share some results we had from our second reflection poll. And that one was to add 3 things that someone said or did that was helpful. Actually, that was our first reflection poll. I see some responses. Someone said that peers have empathy for clients. They can encourage by sharing their own story that recovery is possible. Peers are willing to help. In this situation, the peer reinforced willingness to reach out to a counseling professional. Yes, that's a great comment. That's absolutely true. Someone said support, hope, and the testimonies during CIT trainings that have helped change people's perspectives. That's also a great comment. Someone also added that sharing similar experiences help guide a new path. Is also awesome. Mutual understanding, and let's see what else. Oh, communication, demonstrating empathy and compassion, and having the listening ear with no judgment. I love that. A listening ear with no judgment is a great way to describe a peer, I think. That is fantastic. And then from our second reflection poll, what was unique about Adam's experience because he was provided with support from a peer. Someone said that Adam felt heard and eased some of his fears. That was someone that he truly felt understood what he was going through. Adam was able to hear from someone he could relate to. It's absolutely true. He had a special type of support that was used to help him. Sharing a similar experience, which helps build trust and guidance. I think that's also very true of a peer support. Debriefing and support. Someone else added that peers are important because they have walked in the individual's shoes. They've overcome these challenges, so they are empowering others. That's fantastic. Let's see. Oh, and this is another great one. He was willing to get help knowing that someone had the same experience and they got help first. I think that's also a great reflection from that example.
Living embodiment of recovery. Wonderful. Thank you, Rachel. All right. Well, if there aren't any questions, nobody has anything that they want to ask about this training or of Sataniel, we can go ahead and give you some time back today. Thank you all so much. This last slide before we close, I want to take a moment to encourage all of you to follow DMH on social media to stay connected and to be the first to hear about upcoming trainings and opportunities. This is a way to follow DMH, and I think we have a list of upcoming and past trainings. Sorry, I skipped a slide. These will all be posted to the DMH website. The next monthly training is August 8th and is a law enforcement engagement best practice training. So Rachel, if you want to flip back to I think there was one slide earlier with the list of trainings. There you go. These are the training topics that are upcoming. Again, the next training is on August 8th, and it will focus on law enforcement engagement best practices. So we really encourage you to attend that training and to follow DMH on social media and be the first to hear about upcoming trainings and other opportunities to support the community. Thank you all for what you do to help the folks of Mississippi. It's been great to be with you today. Have a great one. Bye-bye.